So welcome back to episode number 3, Uncancering Cancer, conversation with Dr. Nitin Singhal. So in this episode, we are going to talk about another beautiful treatment, which is HIPEC, HIPEC, hyperthermic intraperitoneal chemotherapy. Yes, we all know that what is chemotherapy, or we are slightly aware about it, chemotherapy, that it treats the cancer. Okay, but I actually want to ask that, after hearing hyperthermic, like it is an obvious that it related to, something is getting boiled. So please tell me that our organs are actually getting boiled just like the French fries getting boiled through the water. So please shed light on it, sir.
So first of all, congratulations. You uttered the full form in a complete way. The
Yes,
you did not do any mistakes in that.
Yes, I really did that.
For a non-medical person, it was a really tough one.
Okay, thank you so much.
Now, I don't know about the French fries. I'll try to explain it as I would say in a layman's term as possible. So HIPEC, basically it's a novel form of therapy, and it is not that novel now because I have been doing this treatment for now almost 8-9 years. So when I started this treatment in Ahmedabad, I was one of the pioneers who started. So in 8-9 years, we have already close to 300 plus cytoreactive and HIPEC procedures now. So it is no more that novel therapy. So let me rephrase that. So it's a relatively novel therapy. So basically it's a therapy which is actually meant for certain cancers which have spread into the peritoneal cavity. So what is peritoneum? First we need to understand that. So our body in the abdomen, that is our पेट जो हम लोग आम भाषा में बोलते हैं, that is basically having all the major organs of the abdomen, and they are covered by a layer, a protective layer, which is known as peritoneum. It's a thin layer, and normally it secretes some fluid which helps in the smooth mobility of the organs inside the cavity. Now there are certain cancers which arise primarily from this layer itself, or they originated somewhere else. Like example, ovarian cancers, stomach cancers, or cancers of the colon, that is the intestine, large intestine, and they actually go and land up and involve this layer, the peritoneal layer. Actually what happens is then it leads to production of large amount of fluids in the abdomen, and our tummy gets filled up, it gets bloated up, and typically these cancers were considered as late stage cancers or advanced cancers, and till few years back they had a very dismal, I would say, outlook, and the prognosis used to be really bad, and considering as stage 4 cancers, many of them would have not made it for even few months also. So it was that bad. Now with this advent of this therapy, what we do is it's an advanced form of surgery in which for such tumors we do a major surgery first, which is known as cytoreactive surgery. It is not one surgery, it is a combination of many small surgeries or many large surgeries, whatever way you describe it, wherein our objective is to remove whatever visible tumor inside the abdomen. Our objective is to remove that, and that takes several hours. Let's say for 5 to 6 hours, which in a typical case, to certain cases which may take more than 12 to 13 hours altogether. So in that, first we remove all the tumor from the abdomen. It requires sometimes even removal of certain organs also. And once you finish doing that, after that, what we do is we subject the abdominal cavity to a course of chemotherapy. That is, during the surgery itself, we inject the chemotherapy inside the abdomen, and this is in a controlled environment wherein the temperature is controlled, and this heated chemotherapy, specific chemotherapeutic drugs which have the property that they don't go beyond the abdomen, that is, they are confined in the abdomen only, so that in a more targeted, in a more precise manner, we can kill the cancers in the abdomen itself.
Of course, it is beautiful and it sounds like very accurate, but still it is like also sounds like very scary, because what I'm feeling is like organs are being washed up in a high temperature. So what are the success rate of it?
So first to clarify the organs getting washed up, now the temperature typically uses 41 to 43 degrees Celsius depending on the indications, and most of the cases it is somewhere around 41 to 42 degrees Celsius only. And typically this is the temperature, the warm water that we take for bath. So it is not very like deep fried sort of a temperature. It is a warm water which we normally use for our day-to-day bath also.
Yes.
It is not a cold water, it is warm. I would say slightly warmer water.
It is not hot, it is just warm.
Warm or maybe slightly more than warm, but not
okay.
hot, not exactly hot, which will lead to, I would say, corrosion of the organs. It is not that hot.
Which will take while having green tea.
Yes, something like
Okay.
that. And in which we put the chemotherapy. And why this is needed is actually to potentiate the effect of chemotherapy. If I put the chemotherapy like this without the heat, probably the penetration power of the chemotherapy will not be that great, and then the desired outcome will not be there. Now, coming to the success rate of this therapy, now how we define success is something that needs to be taken into perspective. So whenever my patients, they come to me and they ask me about this therapy, I counsel them in this way. It depends on many factors. First and foremost is the indication for which we are using this therapy. As I already mentioned, this is a therapy that we are using for stage 4 cancers. Stage 4 cancers, first we need to understand, in generally we are trying to treat something which was incurable till now. So it is something, a grave disease, and not only in terms of the disease perspective, but again when the patient reaches that stage, generally the general condition of the patient is not that great to tolerate the therapy. The second thing that I need to see is the performance status, or how good the patient is to tolerate this therapy. These two together will actually form the major bulk of me having the discussion with my patients. Also, we need to take into account the other treatment options that the patients have, and in togetherness we decide whether to go ahead with the treatment or not. And in certain cases, like example, the first indication for which this therapy actually started, the pseudomyxoma peritoni, or it is also known as the jelly belly tumor. So wherein the tumor was filled by jelly sort of a material, and it actually originates from appendix. And in certain other tumors like say peritoneal mesothelioma, which many times people mistake with tuberculosis of the abdomen, there this therapy can actually lead to a complete cure also. Many patients are there who have a survival of 5 years, 10 years, or even beyond that. That is, they are cured. So for those patients from whom it was practically impossible to have a lifespan of more than months, and I'm telling like say 50%, 60% having a complete cure, then yes, definitely is a very successful therapy. At the same time, we also have a condition, let's say like ovarian cancer, where addition of HIPEC can prolong your survival and can prolong your chances of having a recurrence back, and in some cases it can lead to cure also. But it is not a short therapy that if I have given HIPEC, cancer will never come back. That is something that patient needs to accept with this therapy, and I don't want to make any false claims that if you have given HIPEC, the cancer will never come back. So that is one thing that patient needs to understand. And thirdly, then there are certain set of tumors which are very bad tumors, like say significant cell cancers of stomach or rectum or colon. These are generally not the preferred type where we offer HIPEC, but in certain scenarios we do offer HIPEC depending on case to case basis. Now, typically the survival for these patients is going to be 5 to 6 months if we go by the conventional chemotherapy. By giving HIPEC, certain of these patients may live for 2 years, 3 years, or even some cases 5 years also. So the percentage of these patients may be, let's say, 3 or 4 out of 10. So for those 3 or 4 out of 10, yes, HIPEC was beneficial, but other 4 or 5 may not benefit out of it. So it's up to an individual, as a patient, as a family, to understand how to take the success.
So those 3 or 4 out of 10 people got more time to live, or they just actually completely got cured?
So few of them get cured also, and few of them they get more time also.
Okay.
As a surgeon, I can never say yes, you will get cured, you will get more time, or you will get no response.
Okay.
We try to choose the best scenarios where the therapy is used in the right cases, so that the benefits are maximum. But we can never say that yes, when I'm using HIPEC, 100% cases will have the benefit.
Okay. Cancer is still scary. So, what are the potential complications and side effects people usually undergo after choosing this treatment, HIPEC treatment?
So obviously it's a major surgery, and till few years back when actually I was learning this surgery in my alma mater, that time there used to be a series and pertaining to doctors and surgeries. I'm just forgetting the name. In that there was a famous phrase that mother of all cancer surgeries, that is HIPEC. So you can understand how complicated this surgery is, mother of all cancer surgeries. So obviously when you're doing HIPEC surgery, it's not just about giving the chemotherapy, it's just giving that bath of chemotherapy. If that would have been the case, I guess any Tom, Dick, Harry could have done that thing. Even you could have done that thing. You would have done a technical exercise only. But it's more than that. It's understanding the biology of the tumor and choosing the right patients. Then doing the surgery, the cytoreductive surgery, wherein all the tumor needs to be removed completely in a proper manner. Because if I don't remove the tumor completely out, and if I give my patients only HIPEC, then this HIPEC has no meaning. So that actually causes more complications, because I'm dealing with so many organs at one go. I'm using I would say many anastomosis to join back the intestine that we cut. Sometimes we are removing the organs, and we are removing so many parts, and the surgery is going to take so many hours. And because these patients are already having weak immune system because of several therapies they would have taken, and nutritionally they are debilitated, so obviously the complications are going to rise. And on top of that, chemotherapy in general, if patients they take chemotherapy, they have the problems like counts going down, they are having the propensity to get infection. Here we are doing everything at the time of surgery itself, so obviously yes, the complications, there is a potential to rise. But I'm happy to tell you that in last 10 years, this technique has evolved like anything. When I started my journey as a HIPEC surgeon, from then and now, it's quite different. So now what we explain our patient is the standard complication rate with the HIPEC compared to any other major surgery is more or less same, and probably I can say one or two patients may get some extra complications out of 100 compared to any standard major surgery. So HIPEC is now very safe compared to what it was 10 years back. Because this is all because of the better understanding, better learning, and better, I would say, the learning curve of the surgeon also, and the team involved, because it is not a one-man job, it's a team thing. The intensivist, the anesthetist, as well as the surgeon, all three need to be in a sync to make this a successful program.
Okay, that's interesting. So, HIPEC, coming back to this question, that recovery time of this particular treatment is usually same to traditional laparoscopy, or it gets reduced?
By HIPEC? No, it's a contrary. It's as I said, it's a mother of all cancer surgery. So typically the incisions are very big. It's a complete abdomen incision, and as I told you, it's removing all the disease. So it depends on the recovery time. Totally depends on the patient's, I would say, the disease type, and at what stage they had come, and what was their nutritional status at the time of getting this surgery.
Okay.
So it can vary from any amount of time. Let's say typically my patients, if they come for standard HIPEC surgery, they get discharged by day 8, day 9, and for major cytoreductive and HIPEC surgery, sometimes they even take 2 to 3 weeks. 3 weeks, I would say, is a far-fetched time, because that was in the initial learning curve. Most of my patients, they get discharged by, I would say, 12th day nowadays. But it's not just about the discharging the patient. It has, after getting their discharge also, I have my set of people in my team who keep a continuous follow-up on this patient, and they need to be monitored and mentored at home to take proper care of the patient, because for the body to come back to normalcy and have a normal life, it typically takes 4 to 6 weeks after such a major surgery.
Okay, so you just talked about abdomen. Okay, so what are there any other specific types of body parts or cancers which can be treated through this HIPEC?
So HIPEC is a technique which is specifically used for abdominal organs. So typically, what cancers can be treated by HIPEC? So most common use is ovarian cancers, because most of the ovarian cancers that we see in our day-to-day practice, 75 to 80% they come in stage 3C, wherein already the cancer is spread to the peritoneal cavity and has involved certain organs, and there is some ascites or the fullness in the abdomen, because generally patients don't have any symptoms in the starting, and when they start feeling fullness in the abdomen, that is the first time they go to the doctor, and by that time it is already stage 3C. So that is one common indication. Apart from that, recurrent ovarian cancers and certain variety of ovarian cancers like granule cell tumors where chemotherapy does not work well, and abdominal cancers, the most common we discussed pseudomyxoma peritonitis, that was the main indication where it actually started, and peritoneal mesothelioma, which are rare cancers seen in population of, I would say, many thousands. In many thousands we see one patient. So my center where I do the surgeries, being a referral center also, peritoneal mesothelioma, I don't do more than 4 to 5 cases in a year. So it is that rare a disease. So, and apart from that, the indications are now increasing, and it also can be done for patients with colorectal cancers or some cancers with peritoneal metastasis. So basically, these are the indications for which we can use HIPEC. So it is mainly for this sort of tumors, and it is not for all the abdominal cancers also. So that needs to be understood well. And there are some miscellaneous indications where we can pick and use it. But again, we need to be very cautious when we are offering this outside these indications. Something similar to this we have for thoracic cavity also, but it is not HIPEC, it is known as HITOC, which we'll discuss sometime later.
Okay, let me ask the next question.
What I know after all this is like there is no next chemo required because of this much advanced and complex HIPEC treatment. I feel that after this HIPEC there won't be any chemo session.
No, I would differ from this.
Okay.
So basically, HIPEC, what you're trying to say is that we offered the chemotherapy during surgery, the patient will probably not require chemotherapy. That is what exactly you want to say.
Yes.
So practically, it is not like that. So HIPEC is not a substitution for the chemotherapy that we give through the IV route, the intravenous route. So what we need to understand is what are the indications are such that in certain cases you may not actually require more chemotherapy. If IV chemotherapy would have been effective enough, like if we are given by the IV route, then they would have been not need to do such a complex surgery and the procedure. So there is something known as plasma peritoneal barrier, and so that the reason that when you give chemotherapy through the IV route, the same amount of drug which is required for these tumors, and also these tumors, they are not that sensitive to chemotherapy because they have less vascularity. So that is why the traditional chemo does not work well on this tumor. That is why we needed HIPEC altogether. So in certain cases, your assumption may be right. Let's say pseudomyxoma peritonei. In most of the cases, after the surgery and HIPEC, you may not require any other form of chemotherapy. But for most of the other cases, let's say ovarian cancers, or maybe for that matter colorectal cancers, you would be requiring additional chemotherapies over and above this HIPEC.
Oh my God. So more like still requires chemo session. So what would be the cost effectiveness? It could be very costly then.
So cost effectiveness, see, we need to understand why we are giving HIPEC. HIPEC is not substituting the IV chemotherapy. As I said earlier, the normal chemotherapy cannot reach to the peritoneum that effectively. So to overcome that deficit of the IV chemotherapy, we are giving that additional additional dose of HIPEC therapy. So during the surgery itself, when we have removed the majority of the tumor and small, let's say millets like or droplets like tumors are there, they can be killed there and there above at the time of surgery itself. So that will lead into more potentially better killing of the tumors. That is where HIPEC works. So HIPEC is not substituting that. So suppose if you would have not taken HIPEC and you would have done this surgery and the patient would have been on IV chemotherapy, what would have happened for this sort of tumors? They would have come back again, and probably then you would have used more complex therapies. People are very fond of nowadays of the term immunotherapy, some major chemotherapy like targeted therapy. But to tell you that these therapies are very, very costly, lakhs, many lakhs would be the cost for a single month therapy, and that you need to take for months together or years together, and still you may not get that beneficial effect out of it. So now that could make you understand, yes, why HIPEC is more cost effective or why it is required altogether.
Okay. Actually, after hearing all this, I really remember that when I was researching on this HIPEC, I just got to know that I'm sitting in front of one of the top-notch HIPEC surgeon in India, because actually you have done this much number of surgeries in HIPEC, not in India, just all from all over the world. And recently in G20 summit in 2023 in Ahmedabad, you presented that everything. So what would be your experience and what is your I would say like challenging journey? And of course it would be challenging, but what is the challenging case that you would like to share? Please.
So HIPEC is very close to my heart because it's a very technically and physically demanding I would say job and journey, because you are treating those patients who have practically no hope. As I told, it is for mainly advanced cancers. So they had no hope to start with, and these are the patients who are actually the worst of the lot because their body is nutritionally not good, and they are already losing hope mentally. They are not ready for it. And when you're doing such a major surgery in this sort of patients, you're basically making yourself and your life uncomfortable. Because it is not just about operating these cases, it's all more than that. It's about taking the post-op care also properly. Because if you miss on them, even for let's say a half a day, you can miss a potential life-threatening complication, and the margin of error is very less. Because I was so passionate about it and I wanted to develop this therapy and treatment, I had sacrificed many things, and I'm actually thankful to my family who have excused me for this. And it's not a single man's job, it's a team job. So I'm actually thankful to my team also who helped me in doing this thing. And when we started this journey, initially, let's say around 9-10 years back, in first of the few cases, in fact, I slept for almost the entire week, first for 7 days, with adjacent to the patient room, and I used to check my patients every hour, every 2 hours to make sure that I'm not missing on anything. Because such was the fear with this surgery that if you miss anything, the patient would be lost. And by that time, again, then that was starting my, I would say, learning curve for this procedure. So I was also not very sure, and that therapy was also relatively new. Now, after doing so many procedures, we know potentially what are the possible complications, what are the timelines that we need to look into. Then, and now we have a bigger team. Obviously, the life has become much, I would say, cooler and better. But yes, it requires a lot of dedication. This sort of surgeries. It is not for somebody who is thinking to have glamour with this sort of surgery. It is not a glamorous surgery. It is a dirty job in a way, because you're treating all these high-risk patients, and if something goes wrong, it's very easy for others to point fingers on you. So that is how we started this journey, because some people used to think that we are treating such advanced cases, so we are doing unethical work. They were not aware about like this sort of a technology existed. And now people know that this therapy exists. I'm glad now people acknowledge that work, that yes, we have done this sort of work, and rightfully I was invited in G20 summit for one such case. A lady who had again traveled from Africa, and she was incidentally refused surgery from almost all the centers she had visited in India, and she was almost on the verge of going back to her native country, and in a very pathetic situation she landed up with us. We did the surgery, took it as a challenge, and I'm happy to tell you now it's almost 1.5 years that we did this surgery, and she's doing okay. So our aim obviously in that case was not looking for a absolute survival, because that was not possible in that case, but for a patient who had come with that bad a disease, 1.5 year of quality life where she's back into her farms, and I don't know how many more years she will actually make into. Let's say even if she makes 3-4 years, then I would assume that probably my work was done, and she had a comfortable 3 or 4 years because of that surgery. And there are many instances that I can connect to where I can say yes, this case is close to my heart. This case, but all such cases in HIPEC, they are very close to my heart, because personally I remember each and every patient, each and every day I've spent with them, because you spend a lot of time with these patients. But specific, if you ask me, this case which I mentioned in the G20 summit, because it was a hopeless case for me also. Even I was not hoping her to do good, so it turned out well. And there was one other case, a young girl who had traveled from Canada, and her surgery lasted almost 19 hours. So we started almost 6 in the morning, and we left almost 1 or 2 o'clock the next day. So these are the cases, and she's doing still now. She's I would say she spent 2 years now post treatment. She had a recurrence, but still it is managed. But when she had come, she was in a condition where she would have not lasted even for a few months also. Now for her to finish this journey of 2 years and still counting, although she's still requiring some therapies, I would feel yes, that is something that we have been able to deliver to the society.
So, after hearing this answer, I'm really say the passion you have for this, treating cancer patient is commendable.
And so, in the conclusion of this episode, HIPEC is this kind of a treatment option which will, there is no surety of getting cured of 100% surety, but yes, you can definitely get more time of your, more time to live.
So I'll correct you in this again. The message should be like this: there are certain cases where you get cured, but not all 100% cases should take this thing that you will get cured. In those other cases, probably your quality of life and duration of life would be better.
Exactly. So that's what I was saying, that you can get more chance to live longer based on your situation, of course. So and of course, we are completely an honor to have you on this with this podcast, because after hearing this answer, I'm really in awe. Okay, that oh my God, this much passion is keeping it is like completely motivating for all of us, and we are really proud of it. So stay tuned for next episode, because we are gonna start about we are gonna delve deep into types of cancer in next episode. Thank you for watching.